Shalom Havarim. I'm going to speak in English, but it's good to be back in Israel. I was actually, I've been here a few times, and actually when I was a medical student, I spent a month at Tel Aviv, and I was just back there yesterday, and also spent a month up at Ichilov, where I was actually yesterday, Tel Aviv another time, and I just spent the morning at Machon Weizmann, where I spent a summer as a high school student. And it's always impressive to see how much energy and innovation is happening in Israel, and how much of it feeds what happens. Well, we're based in the Bay Area. So I'm a physician. Went to Stanford for medical school. Did my residency at Mass General Hospital, and I was actually back there a couple of months ago, reuniting with our compatriots for the 200th anniversary of the hospital. And one of the realizations I had as I wandered through the places, it hadn't changed that much. And that much of medicine is still sort of done the old-fashioned way, defined by silos, academic silos, by departments, by fiefdoms often, and that we're often defining our patients by body parts and biologies, and different body parts and different cardiology, hematology. And I'm a hematologist oncologist. Things are subsetted in sort of an old-fashioned way, and through some of the technologies that we'll mention briefly here, and Salim talked about, we can start to potentially reinvent healthcare in new ways. Many of the technologies that have emerged in the 10 years since I finished my residency, from low-cost genetics, which we'll talk more about, the speed of the internet, Twitter, social networking, all those have emerged in 10 years and are becoming really important tools to apply to healthcare to address some of the really major problems that we have, whether we're in Israel or United States. We have a lot of patients or individuals who don't have care at all. We don't often take care of patients in logical ways. We have very fragmented care. Most of our records are still on paper. And we're often under the constraints of regulatory and reimbursement regimens that are very difficult. But we're in this era of exponentials, as we have a theme at Singularity University, and many of those technologies are starting to have a place in affecting health and medicine, not just healthcare, but health and keeping people healthy. And I have an hour, right? No, just kidding. I'll touch on some of these technologies. I'll try not to speak too quickly. But I think one of the themes here, and one of the themes of Singularity University, is that it brings people together from different domains and looks at where technology is converging and how those can address major problems, including many of those we have in health and medicine. And we're really, I think, going to start leveraging many of these that are listed here, and I'll discuss briefly, in a new era of health and medicine that can hopefully address some of the major problems we have. And many of the people here, from MIT graduates and beyond, are in fields that can touch medicine, whether that's artificial intelligence or gaming or apps or robotics or nanotechnology. And as we're seeing, at least in the Bay Area and California, many people are coming to healthcare from these fields and applying new sets of skills. One of the major opportunities we have, at least in the U.S. healthcare system, is to start shifting this curve to the left. Most of what we spend our healthcare dollar on, at least in the U.S., is on the 20% of patients who have chronic disease, and that's where we spend 80% of our healthcare dollars. If we start to spend more of our focus on prevention and keeping people healthy and better monitoring and early diagnosis, we can both live longer and healthier and also improve our healthcare economics. So Salim mentioned a few exponential technologies. My favorite, we all have in our pocket. I grew up with a rotary phone. Certainly no texting. This used to be really cool, right? Like, wow. And it started again as, for the rich and famous. Now it's ubiquitous. The bottom billion on the planet all have cell phones, essentially. And these phones are now becoming really health platforms. They're really not just for communication the old-fashioned way, but are becoming medical devices in some settings, to the point where now we're starting to connect phones with diagnostic devices, not just databases. For example, this is a phone connected to a glucometer for diabetics. So we've been studying, I've been the chair of the medicine track at Singularity University. We've also done one-week executive programs, and Robin, who's here, and I have chaired a program twice called FutureMed, where we're looking at where technology, many of the ones we'll mention briefly, are affecting health and medicine, and brought together a wide array of physicians and other technologists to look at where we can take healthcare. So a few examples. Back to the phone. There's over 20,000 different apps that are just health and medicine related today. Some are for tracking your weight, some are for tracking your pills, some will tell you whether your drug is valid or not. In Europe, they have a chip you can cough or pee on that will check for sexual transmitted diseases. I think it's made in France. And as I mentioned, the phone is now being connected not just to chips you can cough on, but importantly, diabetes, a big medical problem. We now have an integrated device that can measure your glucose, but now record it to the cloud, measure your trends, communicate with your doctor or your family, let them know when things are off or when they're on track. And this theme of being able to digitize your data, see your information, understand it, and improve upon it, that feedback loop, I think, is a new theme in healthcare. Normally the feedback loops in medicine are months between visits, scribble pieces of blood pressures or glucoses on paper. Now we can track those with dashboards and give you as a patient or myself as a clinician much better insight into what's happening at a much lower price point. So let's look at how some exponential technologies are affecting healthcare. Salim mentioned the speed of computation. Clearly the computer is getting faster and faster. We can't quite upload our brain yet. But where this is affecting healthcare is mostly in the world of imaging. The computers are getting so fast, and the imaging technologies are getting better and better, that we can collect massive amounts of data and have levels of resolution and insight that were unimaginable a few years ago, and give better diagnostics as well as therapeutic platforms. The scanners are getting smaller, but the data sets are getting exponentially larger. Today, a standard CT scan is about 800 phone books, for those of us who still have phone books. Tomorrow, they're a terabyte worth of data. And that gives us a question. How do we store that information? How do we manipulate it? And what are the opportunities to leverage that in new ways? One is, the movies aren't working here, but the idea of virtual colonoscopy. And if you would imagine here, if the technology was working, you could fly through the colon like a flight simulator. And that's what essentially replacing the old form of colonoscopy. So sorry about my technology. I upgraded the operating system on the Macintosh. It's been a disaster. So some technologies don't work so well. How about the ability now to send these images not just on your local computer, but up to the cloud? And when you can take this data and massively analyze it with high-speed cloud-based computing, we can start to do very amazing analytics, basically taking fluidic computational formulation and now reconstruct blood vessels, for example. And know, for example, instead of taking a patient with heart disease or chest pain, putting them in under a catheter, radiation, imaging the coronary arteries, we're now able to essentially send these images to the cloud and model exactly what's happening in a patient's coronary artery and reconstruct that blood vessel and determine whether or not they need a stent or not. And my movies aren't working. But trust me, it looks really cool. You can upload it to the cloud and understand whether that patient needs a stent or not. A company out of Technion, I believe, called Insight Tech, is now merging the integration of high-speed imaging with MRI with focused ultrasound. So, for example, a patient with a breast tumor or liver metastases or brain tumors, integrating both imaging and ultrasound to knock out potential tumors. And this has already been approved for uterine fibroids. So we'll see less invasive, more effective ways by merging different high-speed technologies. I've been a pilot and a flight surgeon for 10 plus years. We're learning a lot from other fields, like the field of aviation. And many of you are in the military, when you fly a mission, you brief a mission, you fly a mission, you debrief a mission. Those sorts of applications from the aviation world, for example, are now being applied to healthcare. Sometimes they're simple technologies, like the checklist. And there's been now studies based out of Harvard by Atul Gawande, a surgeon, and others. Simply applying checklists to the operating room can dramatically improve outcomes by 30 or 40% in terms of less complications and less mortality. Checklists, for example. How about the example of simulators? Obviously, another computationally based system. This has dramatically improved airline safety. It's now starting to dramatically improve medical care. If you're an anesthesiologist or a medical student trying a procedure for the first time, or a very rare event like your engine catching fire, you'd like to be able to practice that, and that's now being simulated. I know there's a very amazing simulation center here in Tel Aviv I visited several years ago that was founded by a former Israeli fighter pilot. So simulation is becoming big, not just for training or simulating whole cases, but for learning new things, how to operate, or how to operate on that exact patient's anatomy that you'll be seeing in the next hour. The concept of air traffic control. I think now that we're starting to have digital records and you can see what's happening with the whole population, the idea almost like radar, where are the other airplanes, where are the other patients, what's happening to them, how's the weather affecting them, for example, is starting to happen in the field of medicine, where a triage nurse or a doctor can see a patient within context of other patients like them and start to make better decisions. Look at, for example, a map of where there might be influenza or other infectious diseases and make better clinical decisions. And all this, I think, is coming together as an era of digitization of healthcare. 4 minutes. Ooh, well, I'll talk exponentially quicker. Digital healthcare is coming along. We're sort of in this new era, I think, of big change influenced by the integration of mobile technology. Phones, more phones than we have toothbrushes on the planet. There are now apps that are being connected to my stethoscope, for example, and the stethoscope is quickly being replaced. For example, I have on my phone here the ability to do an EKG. This is invented by my friend Dave Alberts. He built an EKG basically into the iPhone case, $10 case. So this could be very useful if you're an ambulance driver, a triage nurse, a cardiac patient. You might be able to see my heart rate there being recorded, stored on the phone, sent to the cloud. Basically free data that can basically change healthcare. Phones that will now enable you to look in your child's ear and diagnose an ear infection without going to the pediatrician. Or if you're in an area without ophthalmologists or optometrists, technology out of MIT's Media Lab is now being commercialized to enable eye screening and optics. Star Trek, we're coming to the era of the tricorder. Where now handheld ultrasounds are only a couple $1,000s. They're replacing $100,000 devices. Those can now, you can press a button and Facebook your ultrasound, for example, or share it with another physician or friend. And this combination of mobile devices, digital health, that the records are now moving to being digital. In the United States, about 30% are digital, is changing the way we understand information. We can crowdsource information. They're now online free electronic medical records with 30 million patients underneath them, so we can start to look at different patterns of disease. We can now carry our medical records in our pocket on mobile devices, so that can make the, if I'm on call for the weekend, I can take care of my colleagues' patients much more effectively. Another exponential trend is technology is artificial intelligence. Many of you may have seen Watson beat the best champions in Jeopardy about a year ago. And IBM is actually applying this technology first to healthcare. They're working with major insurers and some medical centers. And I think we're going to see the application of AI, or IA, intelligence augmentation, to really help the nurse practitioner, the physician, make much better, faster, more efficient sense of all the massive amounts of information that are coming to us digitally. And just a few examples of how that might change, let's say, dermatology. You may not need to go to the dermatologist in the future. You can download a little app, scan your skin lesion, determine whether or not that looks like a melanoma or not through an AI in the cloud. Just one of many examples of smarter ways to do medicine. There is actually a Tricorder Xprize that's just been announced with Qualcomm, $10 million prize. I encourage many of you in the community here to enter the competition. How can we bring and integrate these technologies onto a handheld platform? And I don't know what happened to my images, but I will just say that the technologies don't need to be fancy. You can use Skype or FaceTime on your phone. You can use texting to do better messaging. You can use gaming technology like the Kinect, not just for gaming, but for maybe physical therapy or to help with diagnosis of a stroke. We're starting to use those in the operating room, for example, to control images. So simple, again, $100 technologies being adapted into the healthcare setting. Robotics, telepresence, all these are moving pretty quickly. This is a company developed out of Tel Aviv called EarlySense, a pad that you can put underneath the patient's mattress that can monitor their heart rate, respiratory rate, and movement. And I think that's going to have important impacts in the clinical setting. And eventually, you'll have one in your mattress at home. It'll start to watch your health over months or weeks and help you make a better track things. And where this is sort of heading is a whole slew of these smaller devices, things that will track your breathing, wheezing, are entering this era of quantified self. Small devices like the Fitbit that can measure how many steps you've taken, so that can be important if you're trying to improve your habits, like how far you're walking. Devices that'll track your sleep, like the Zeo, again, $100 devices that will enable you to optimize sleep. Whole slew of technologies that I don't have time to talk about, but they're all merging together. And I'm going to apologize for my computer and just say that when you can measure your blood pressure at home now accurately and feed that information back to your doctor, that's going to make a big impact on, let's say, hypertension, which is a big cause of long-term disease. And when we start to have sensors everywhere, in our clothes, in our cars, in our tattoos, kosher tattoos, we'll start to be in the era where we can start to analyze this data, integrate this data, kind of like your car now has a whole bunch of sensors and lets you know when there's a problem with the light going on. We'll have similar sorts of sensing technologies integrating multiple data streams so that you'll look in the mirror, you'll know what's happening, you can use the urinal and give you information, or maybe even the huggy diapers of the future will give you important information. Virtual reality or augmented reality, looking in the mirror and seeing the healthy you that you'll be if you stop smoking, or what you might look like if you don't stop smoking. those are powerful tools. When you start to use these sorts of imaging, whether it's looking at your data, right now it's kind of boring data, but if you can use smart user interface to redesign the laboratory exam, you can do powerful things to improve your understanding of information and be more connected to your healthcare provider and your own health. Okay, I've got to speed up and mention that robotic surgery is here. I thought I had 30 minutes. No. Robotic surgery has already been around for 15 years. We're starting to layer on other technologies from enhanced vision, the ability to improve our ability to operate and see inside the body, eventually without any going down the stomach and out. We're in the era of brain-computer interface, the ability to take a quadriplegic, put a chip on their brain, allow them to control a wheelchair, a cursor on a screen, a robotic limb. Brain-computer interface devices are already getting cheap enough that you can use them for gaming. These are $100 devices you can use to control things, to learn about meditation, for example, which can be used effectively to improve many diseases. And there's sort of apps that are being integrated with brain-computer interface. Even robotic limbs are soon going to be connected in new ways, in more powerful ways, integrating multiple technologies. How about robotics to enhance people who can't walk? This is a patient who hasn't walked for 2 years because of a motorcycle accident. He can strap on lightweight robotic exoskeletons and now walk. It's a big game changer for him psychologically, but also will get people who are not fully paralyzed walking more effectively. I'll finish up with 2 other trends. Is exponentially smaller. So accelerometers of 40 years ago were huge and cost $100,000. Now you have accelerometers in your phone, and that's a way of measuring your health. An eye pill, which was developed partially in Israel, is integrating multiple technologies as a swallowable device with a camera, so we can see in your GI system what's going on and release drugs and make diagnoses. Stanford is just developing a new little chip that can be, you can see it on the palm there, that can be directed to fly through your blood system. Several other examples of things getting smaller and smaller, from pacemakers to eventually contact lenses that you can wear that will be integrated into your eye, beam you information so that you can get feedback, like when you're driving your car, like a GPS that tells you to go left or go right to improve your health outcomes. We don't want too much information. We want enough information, whether you're an anesthesiologist looking at medical data or someone trying to lose weight. These will become increasingly useful as we integrate them together. Fluidics, labs on a chip, that's another area getting smaller and more capable. And that's allowing third world medicine to be equivalent in some cases to first world medicine. The ability to do point of care diagnostics, much more enhanced telemedicine is bringing healthcare to other parts of the world. And if we go all the way down the exponential curve to nanomedicine, we're at the era of starting to build designer devices, whether they're viruses today and modifying viruses, to eventually the ability to design things that can actually do functional things like clean out your clots or arteries as you go. I'll finish up in the last part by saying exponentially cheaper technologies are coming along in genomics. It used to cost $100 million to do the first couple of genomes, and $100 million, then $10 million, then $10,000. We're now basically at a $1,000 genome. In a couple of years, we'll be at a $100 genome, and that's going to dramatically alter the way we understand our genetics, ultimately lead to an era of personalized medicine where we can pick the right drug for the right person at the right time. We can already do that today for $100 with 23andMe kits. You can look at multiple genes that can help predict information, and we can use that to help predict disease. And we're already using that today early in the clinic for picking the right drug for the right person. I'm going to just skip ahead here and close by saying there's lots of technologies that are moving ahead. Obviously my slides aren't. I'll do this.
Thank God your videos aren't working.
I'll close with this thought. If we want to integrate this all together, we're sort of in this era that can be summarized as P4 medicine. We can start to use genomics and other information from those sensors in our mattresses to our genes to be much more predictive about what diseases we're likely to get. Then we can start to do preventions, and those preventions can be personalized. Maybe you'll take aspirin, but maybe your genetics mean you won't benefit from aspirin. You need another drug. And finally, we're starting to enter this era of participatory medicine where we can share our data on these electronic networks. We can mine the information in new ways. And as Peter says, we like to predict the future by inventing it. We can start to predict our healthcare future by actually preventing many of the diseases that only we discover today too late. So that's a taste of where some exponentials are taking medicine, and I'll hand it back over to Salim. Thanks.
Thank you very much. It's a shame Daniel doesn't have more content in his presentations. We have a couple of minutes for questions while Raymond pops up. Does anybody have a question or two? No questions? Any breaks? In? Smell.
Well, there are nano noses that have been developed already for smelling cancer, for example. So there are actually biologic noses. So dogs have been trained to smell cancer. Some of that's been developed here at Technion and other places. That's being now used as a colonic industry. If you have your own sense of smell, there are stem cells. Oh, okay. So there are stem cells in the nose that have been isolated, and maybe those can help reconstruct smell if it's not working. I haven't heard of a particular therapy yet. Any other questions?
Oh, stretch it out. I got to get this loaded up.
Yeah, 30 more minutes. Legal issues? Wait, so now we're in this era of digital medicine. I might carry my entire medical record and everyone in the room's medical record on my keychain, right? What happens if I lose that? Or if I'm a doctor and I have access to all that through the cloud? So there's obviously privacy issues. That's already been an issue with stolen credit cards. There will be stolen medical records. There's a... isn't it amazing we're at Technology University? We can't, and we're at MIT, and we can't get our AV to work. There's also issues.
We often say at Singularity University, AI is easy, AV is really hard.
Really hard, right? So privacy is one concern. Also, now that these devices are connected, like the pacemaker I showed you very quickly, has an IP address. So what happens if I can hack your pacemaker? There'll be probably crimes of the future crimes, and we have an expert on that, Mark Goodman, who says, imagine in the future, you're going to get a text saying, go to the bank, take out 1,000,000 shekels, or I'm going to turn off your pacemaker, right? Or other sorts of cyber crimes that really tell. So it's a slippery slope. I mean, people are getting more used to sharing information, like on Facebook. Facebook, by the way, I didn't have it mentioned, is being studied now for health, and you can start to see when your friends are going to get the influenza or the flu, and you can avoid them. So. We're going to